So now I'm going to talk about what is actually being done across the country and funded by Commonwealth Government Department of Health and Aged Care and Disability. It's called the Every Moment Matters campaign, and it is in fact one of the largest campaigns funded in public health history. And I'm very pleased to be involved in the evaluation of this campaign. It includes a huge range of collaborators across the country and a large evaluation team. I'd like to acknowledge them today, particularly Joanna Caruso, whose work, some of this forms part of her PhD. We also have a wonderful advisory team listed there as well. So in terms of the overall campaign development by FARE and partners, it's had a huge amount of formative research. So in October 2020 through to January 21, literature review of other campaigns and key informant interviews. Stage 2 was about defining the target audience, developing messages and testing those messages. And stage 3 was about concept selection and testing the effectiveness of those. That resulted in the Every Moment Matters campaign. And I'm not going to share the actual ad with you because that always makes me nervous, showing kind of ads and whether the sound will work, but there's an image of it there. And the tagline is, make the moment you start trying, the moment you stop drinking. It had a huge range of social media and digital promotion, billboards and retail posters. It had 4 streams. So stream 1 was about a national community awareness campaign. Stream 2 was about support for priority groups through No FASD. Stream 3 was about information and training for health professionals. And stream 4 is about health promotion programs for regional and remote Aboriginal and Torres Strait Islander peoples by NACCHO. We're involved in evaluating all of those, but I'm going to talk particularly about stream 1, which is just the National Community Awareness Campaign today. But I welcome comments, questions later about the rest of the streams. So overall, the campaign itself is designed to increase awareness of the risks of alcohol consumption during pregnancy and breastfeeding, including awareness of FASD itself, knowledge that alcohol should not be consumed during pregnancy and it's safest not to drink when breastfeeding as well, and overall increase the proportion of Australian women who intend not to drink any alcohol during pregnancy and breastfeeding and do not drink alcohol during pregnancy and breastfeeding. So on the left-hand side there of that image, and it is a little bit small because you can see there's a lot going on, are the campaign bursts. So from 2021 to 24, there was a large, significant investment made through a number of bursts. On the right-hand side, you can see the evaluation. So at 2021, we did a pre-survey to understand kind of what awareness was at the population level nationally around a range of things. Then we did a post-campaign survey in October 2023, and I'll talk about those results. But throughout, we also did some online tracking surveys as well to understand people's awareness of the ads and whether they were hitting the right mark to provide kind of real-time guidance to those that were buying the media. So this is some pre-post evaluation results, and you can see here significant increases in these key behaviours or awareness that we're looking to increase, or the campaign was looking to increase. So significant increases in awareness that there's no safe amount of alcohol, no safe type of alcohol, and no safe time to consume alcohol. And while they look like small increases, they're really substantial at the population level. In terms of intentions for behaviour change, among those planning a pregnancy in the next 2 years, there was a significant increase in intention to abstain from drinking. We saw drinking behaviour remain stable in those currently trying to conceive, but that may be a function of the fact that there aren't a huge number of people to be able to survey in that survey for that particular measure. Among those that have planned pregnancy, significant increase in abstinence there. So some good results there too. In terms of the tracking survey results, we were really interested to see campaign recognition did increase each time and increased significantly from the first kind of wave that we did right through to November 2023. Then there was a big gap in campaign activity, so no campaign activity for about a year. And then the campaign started to be aired again, and you can see started at a lower base rate of campaign recognition and then increased a bit again over time. You can see here with this slide, this shows the kind of key campaign messages, and there are a lot here, but basically the message that I'm trying to give here is that most of the campaign messages had significant increases, particularly in that sort of early campaign large spend time. And then we've seen some increases in the kind of extension part of the campaign as well in a number of those messages. So that's kind of a whirlwind tour through the national campaign, but the take-home messages of it all are that values and strength-based campaigns can be effective in increasing awareness of harms, knowledge of public health advice and changing behaviour, but progress can quickly stall and even can reverse back when campaigns stop or pause. They must be evidence-based. Messaging should be informed by community and lived experience and pilot tested as well to make sure it's going to have maximum impact. They must be targeted in the sense that when you're buying the media, targeted to the right audience and remain focused. They can't be all things to all people. They must be funded at levels that allow a comprehensive media buy and a sustained campaign. And initial and ongoing evaluation is key and will inform future approaches. We did find that having that kind of tracking throughout the campaign, rather than just having one kind of baseline measure and then one post a couple of years later, just having that would not be enough to let the Commonwealth know that they're investing significant amounts of money and it's having impact. So having that kind of tracking throughout was really important to provide that real-time feedback and to make sure people, the right messages were getting to the right people. So that's kind